Sorry, Phil.
No, go ahead.
No, that's okay. Just getting us started here on our monthly call. Just to remind everybody, you're all muted and we are recording this session for future use. With that, I'm going to hand it over to Phil Koch.
Great. Thank you so much. Appreciate it, Edward. Good to be here with you all once again on this Thursday morning so we can talk a little bit about how we're responding to the COVID crisis from the human services sector side and the best ways in which we can help our communities through this pandemic. Today, we've got a great lineup. Once again, Alyssa Cholodowski from United Way is here hosting this call with me, along with Dirk Matson from the county. Dr. Fox actually can't be with us here today, but she did send a report for me to read, and she apologizes that she can't make it. Bud Mertz is here as well from Public Safety. Dr. Conway will join us from the Intermediate Unit. We've got Jennifer Miller from the Food Bank, Deb Thakra from Feeding the Spirit. Ann Emmerling is actually going to be joining us today as well to talk about housing and domestic violence. And finally, we'll round that out with a report from Jordan Polito from the Hill Group, who is working in partnership with United Way and the Community Foundation of Westmoreland County to lead a human services study, or a study of the human services sector in Westmoreland County. He's here to give us an update on that process. So glad that they're all with us today. I do want to send a special thank you to the Westmoreland Museum of American Art that gave us this painting that you can see on our homepage. This painting is called Late Autumn in the Woods, and it's painted by Alfred S. Wall. He was actually born in Mount Pleasant, Pennsylvania, in our backyard here, and became a well-respected and influential painter, critic, and restorer in Pittsburgh. Wall made summer excursions to Scalp Level, which is near Johnstown, where he painted directly from nature alongside other artists of his group. So thank you to the Westmoreland Museum of American Art for providing that for us today. I think we should go ahead and jump right in with our reports. I'm going to start with the Community Foundation of Westmoreland County. I just want to send a quick reminder that we're about 1 week away from the due date for our Healthy Communities grants. These are grants to up to $30,000 for organizations that are serving our most vulnerable populations, focusing on children and family that are working on upward mobility, economic upward mobility. They could be programs related to mental health, including substance abuse. They could be programs that are supporting folks that are exiting incarceration and re-entering society. Also could be for children that are living in poverty. Also included would be those that are struggling with housing and food insecurity. Once again, we're just about 1 week away from the due date. If you need access to that application, if you just log on to the Community Foundation's website, under our grant section, you'll see the Healthy Communities tab. If you click on there, you'll be able to access the program guidelines, which will take you to the application. So I encourage you all to look at that if that's not something that you've seen yet. That's all from the Community Foundation side. I'm going to go ahead and pass it over to Alyssa with United Way, who's going to give us a little bit of an update. Alyssa, what do you got?
Great, thanks, Phil. And I love that painting. I just reminds me of autumn, which is one of my favorite seasons.
Absolutely.
But yeah, it was just beautiful. I checked up on some 211 data this morning. Within the last 30 days, we've had over 1,000 calls. So continuing to see a spike from last year in the number of people calling 211. Over half of those calls are coming in for housing. So people are struggling now, thinking about rent payments and such, and rental assistance actually was 82% of all of the calls coming in for housing. So significantly up in that request. And utilities, of course, is coming alongside that, also with a lot of requests. I think about a third of the requests coming in. We see the food calls have kind of leveled off, kind of very similar to last year, maybe just up a little bit. And most of those are just asking where their closest food pantry is. So I think that is happening pretty good there with the 211 calls. People are also still calling about COVID. So we saw, especially end of August, early September, and through the month of September, people calling again about where to turn for testing and other information about COVID. So continue to please refer people to 211, great resource, and thanks to all of our providers who keep their information up to date. We, from United Way, were able to replenish our emergency basic needs funds that Catholic Charities manages for both Westmoreland and Fayette counties. So good news on that. So if you do have anyone who is looking for help with utility assistance, rent assistance, things like that, this is actual money that we can help pay off some of those back bills and current bills so that people avoid a shut off or losing their housing. So still, I think, in the midst of this crisis, and United Way is glad to be able to help as much as we can. So thanks, Phil, and looking forward to everyone's reports.
Great, thanks so much, Alyssa. Dirk, over to you. I think you're on mute there.
If you could move it on. Oh, thank you very much. What you see in front of you are the graphs for the cases in the new cases in Westmoreland County, and also comparatively to Pennsylvania. Unless you've been living under a rock, which in some regards I have been for the last 2 weeks being away, you've heard about the spike in Westmoreland County, and you know, the number of cases at Westmoreland Manor, and some of the people in the courthouse that have contracted COVID. It's gone up to higher numbers than we've had ever since this pandemic began, and of course it's concerning. My understanding is it's a general spread. It's not all related to the manor, but Bud can probably speak better to that subject whenever it's his turn to talk. But it's just a reminder that all of us need to be following all the precautions that need to be taken. Wearing masks, social distancing, and all the other things that we need to do to make sure we're taking care of ourselves to be able to take care of others. Regarding the spreadsheet that we have with indicators, Tony, my administrative assistant, has had trouble getting responses. I'm going to be following up with the folks that haven't responded to Tony to be able to get the data, and we hope to have that fully, all the fields fully filled out. For those of you who are just joining the call maybe for the first time or aren't aware of this or need reminded, we're keeping a spreadsheet on 39 different indicators of mental health and human services, kind of as a warning device to see what it's like here locally in Westmoreland County. In particular with mental health, because a lot of experts are predicting a mental health crisis, but in general throughout human services as well. And up until the recent time when we haven't gotten all the data, it's been very informative to me. I don't know what it's been like for everyone else, but I found it very helpful. So we need to get the fields completed, and I'll be following up personally myself since I'm back. And that's all I have, Phil.
Great, thank you so much, appreciate it. I'm going, as I mentioned, Dr. Fox is not able to be with us today, but she wanted me to read a report that she sent along. So I'll go ahead and do that. First, she said that Excella remains ready to serve residents of Westmoreland County. They have ample intensive care capacity should that be required, personal protective equipment, and access to testing. She also mentioned that the testing and evaluation site at Fry Farm Road remains open, and individuals who call should call the number, which is 1-800-727-9558. Again, 1-800-727-9558. They should call that number, and they'll answer a few questions in order to determine if they should require a telemedicine visit, a face-to-face visit, potentially with testing, or drive-through testing. The PA Department of Health is currently recommending that individuals who have been notified by the department or a health care provider that they have been exposed to COVID-19 patients be tested at 2 to 3 days post-exposure, and they're able to accommodate those tests if we have folks in that scenario. She also mentioned that Excella is assisting UPMC and Allegheny Health Network in providing support to skilled nursing and personal care facilities in Westmoreland County in the form of assessment for pandemic preparedness, access to PPE should that be needed, help with required testing, and on-site advice and guidance in the event of an outbreak. Finally, she wanted me to stress the importance of folks getting a flu shot. As a matter of fact, in the report she sent me, in all capital letters, she wrote, "Get a flu shot." So there's your recommendation from Dr. Fox. At this point, I'm going to go ahead and send it over to Bud Mertz with Public Safety. Bud, what do you got for us today?
Well, good morning, everybody. I'll just follow up on Dirk's message to everybody, because I don't think that we can say it enough, that they, from the beginning of this COVID crisis that we're in, there's been consistent messaging going out from the Department of Health and just about everybody else from there. And it talks about wearing masks and washing your hands and distancing yourself. Right now we are experiencing an uptick in cases, and but the message has to go out there. I mean, this is not all congregate care. This uptick isn't all just congregate care facilities. There is a definite uptick based on community spread. When I say community spread, I mean the practices that we're doing out and about in the public has made us a little bit more vulnerable. We might have left our guards down. So I just really want to jump back and think about what it was going into this. When we knew that the spread was coming to Pennsylvania and to Westmoreland County, and some of the practices we've done. I mean, that doesn't mean that you have to totally isolate yourself, but it does mean that that you have to be very conscious of your actions, and go find the hand sanitizer, and if you're going shopping, when you get back into the car, put an application on before you touch anything else, and make sure you are wearing masks, and be conscious of where you're being around other people. There is an uptick in community spread, and you have to do everything that you possibly can to mitigate it. I think right now, as far as the Pennsylvania, or as far as the Westmoreland Department of Safety goes, our tactics continue to remain the same, obviously, because we're in this deep. And our first priority is the monitoring of our 911 calls, so that we have an idea of the severity of cases and how it affects the EMS response, the ambulance response, to make sure that we do have EMS providers available if we start getting an overflow of calls based on COVID or anything to that matter. We can say right now that the screening that we're doing, and the screening that we're doing when somebody dials 911, we're seeing probably about a 4% rise in calls. And we did have a meeting with the county's EMS directors over the weekend. So we continue also to reach out to the congregate care facilities, the nursing homes, and the personal care homes. As you've seen on the news, the Manor has over 100 resident cases right now, and staff cases. Fortunately, a lot of those are asymptomatics, and they're experiencing little to no effects of the virus. But there's still a huge practice that they have to follow to remain isolated, in the practices there. We just hope that they can go through the virus, the terms of the virus in their system without having any symptoms. But nonetheless, they do, and all the practices at the Manor and the other facilities has to stay the same. We talked about the jail a little bit. It's been in the paper that a couple of the staff people have it, and obviously there's an aggressive reaction by the jail and the county in making sure that isolation procedures are in place, and those type of things. So we continue to move forward with everything. And you know, I keep on going back to the fact that this is a virus. It's not politics. It's a virus. Anybody and everybody can get it. And you know, your best defense is the same mitigation tactics that we started out with. And wear a mask, distance, wash your hands. Those type of things can mitigate the issue for you. And we have the just go back. We still have a lot of the cloth masks that was provided by the foundation for the nonprofits, and those are still available. And feel free to you know, contact our department if you are in need of any more masks to follow those same mitigation practices that we started with. That's all I have. Thank you.
Thanks, Bud. I'm going to title your report "Back to the Basics," and you know, let's get folks to wear their mask. You know, once again, just to reinforce, as Bud mentioned, if you have staff that need masks, if your organization needs masks, clients, please reach out to Bud. We've got those masks available, so there's no reason why we shouldn't be deploying those resources if that's something that's needed. And when those run out, I know that my colleagues over at the Fayette County Community Foundation still have over 100,000 masks that they're ready to distribute to nonprofit organizations in the region. So if we're running low in Westmoreland, we have access to them. So it's not an issue of access. So we just need to make sure that that message goes out, back to the basics, wearing masks. So hope you don't mind, Bud, me adding on to your, putting an exclamation point on your remarks. I'm going to go ahead and move on over to Dr. Conway, who's here with the Intermediate Unit. Dr. Conway.
Good morning, everyone, and thank you again for the opportunity to share an update. A few items I would like to share. School districts and non-public schools continue to work as best they can to get students back into the classroom 5 days a week. However, most of our districts are on hybrid models where it's either scaffolded or Monday, Tuesday on, Wednesday, Thursday, Friday being online, and vice versa. Now, as cases continue to spike, we know that is going to be more of a challenge to attempt to get students to come back full time. We're starting to see a number of schools having to close down due to cases. We've seen classrooms needing to be quarantined because of cases. So we're going to be, I think, struggling with that from now through the winter season. Another big item in the education world was the amended targeted mitigation order, specifically around events. Attendance at athletic events, indoor and outdoor, have been a very hot topic within the community. And with the amended order raising the capacity to certain percentages based on the overall fire code occupancy of a event, has provided a pressure relief valve for our districts to allow more people to come in into those events, indoor as well as outdoor. Also wanted to share that through the federal government, the PDE has started an initiative about 2-3 weeks ago to provide a mask to every single student within the Commonwealth. And it's thanks to the federal government that PDE was able to secure those masks. The intermediate units are serving as distribution centers for those masks. And so we have been in contact with districts and our charter school. And if non-public schools have a need, or preschool schools, centers, they can reach out to me if they have any requests for masks. The original order was for the public school districts. However, PDE has allowed, if we have additional masks available, for us to be able to distribute them to those other sites. So we're very thankful for PDE providing that for us. And last but not least, I just wanted to share that RIU is part of the Pennsylvania Association of Intermediate Units, which then represent intermediate units in the programs that we provide. And as many of you know, our intermediate unit runs the early intervention program, and that's a program for students with disabilities between ages 3 and 5 prior to getting into pre-kindergarten, prior to going into kindergarten. And early intervention was only funded at 5/12 of a budget, only 43% of last year's total allocation. And so we've launched a campaign to bring awareness to the fact that it hasn't been fully funded, and we're hoping that they keep their promises for at least funding at levels of last year, like the other programs that they have. So if you have any interest in that, feel free to reach out to me. I'd be able to provide you more of the talking points and things like that. It is a PSBA Advocacy Day today, so board members and superintendents are going to be meeting with legislators virtually all throughout the day, talking about the many different issues that have been impacting schools through the COVID shutdown. With that, I appreciate the opportunity and thank you for letting me talk today. Thank you, Phil.
Thanks, Dr. Conway. Appreciate that. We know how important that advocacy work is, so I invite folks to reach out. That'd be helpful. At this point, let's talk a little bit about our folks in the county that are food insecure. I believe Jennifer Miller is going to start us off with the food bank.
Good morning, everybody. Thanks for having me on again today. Things have been different at the food bank, especially since March, needless to say. The numbers at our food pantries are kind of leveling out a bit. However, we're seeing an uptick in phone calls from people that are food insecure and are looking for a food pantry. We are getting a lot of referrals, like Alyssa said, from 211, people calling into the food bank to get a referral to their local food pantry. The CFAP, the Farmers to Families distributions are over now. There's no more distributions at the fairgrounds. Our last one was on September 28th, which was actually a Convoy of Hope distribution through Ben Roethlisberger and Vance McDonald. It was a wonderful distribution, but the two distributions that we did have in September were low. When I say low, it's one was 800, one was 900 households. Needless to say, that's not very low, but considering we were at 1,000 households and more, and we're turning people away prior to that, kind of gives me hope. But at the same time, we're seeing that uptick in phone calls looking for a food pantry. One of the things that we're hearing a lot about is people are now losing their jobs, getting laid off or getting terminated completely, and are looking for avenues to feed their families. So still seeing some special diet needs out there for people who are unemployed, and accommodating them as best as possible. The income guidelines through the state are back intact. However, if you encounter anybody who is in need, we have the ability to be able to provide food to them and emergency services through our donated foods and gift cards to be able to get them over that edge between unemployment or over the hump from being sick or whatever the case might be. We're hearing from people. We're hearing that it's still dire out there. Our goal is to go back to whatever normal is come February 1. That all depends on what the virus looks like. If we're back in red phase or back in yellow phase, then we'll be back to pre-packing. It is just becoming to the point where we're losing volunteers. We're burning them out. Today, we're lucky to have the United Way's Day of Caring at the food bank. So we're hoping to be able to get a lot of the dry pack today for the coming months. There will be a turkey in every food box come Thanksgiving. Thank God we were able to get the funding for that, and actually a ham in every food box for Christmas. So we are so grateful to our funding sources from all over the region, all over the state, that have been able to provide the food that we have. It's there, that we have the food. That's not a problem here in Westmoreland County. We did have a visit from the CEO of Feeding America last week, 2 weeks ago. Boy, time flies. And she was very impressed with what the state has accomplished on the hunger fighting or food insecurity level. very complimentary to our local foundations, very complimentary to our processes here in Westmoreland County with dealing with the allocation method rather than the choice method, which is really coordinator choice when you think about it, not necessarily the customer or consumer choice. So a well-rounded food box is very much appreciated by Feeding America. So we were very proud of that. Again, I cannot stress enough, if you have a consumer or if you know somebody that's in need, we are here no matter what their income is, you know, getting them started, getting them off of the, you know, back on their feet basically. You know, so we're here. We're not really encountering any major issues, knock on wood, right now. We have been able to provide PPE supplies to all of our agencies. They got a goodie box, for lack of a better word, with hand sanitizer, masks, gloves, and so on. And we have an ample supply here right now, thanks to the county and other donors like Feeding America, of course. So that's really all I have to report right now. But of course, if you have any questions, please feel free to call the food bank or call me personally. Thank you.
Thanks, Jennifer. Very informative. Let's hear from Deb Thakora from Feeding the Spirit. Deb, are you with us?
I am. Good morning, everybody. Like everybody else, it's a busy time and we are moving ahead week to week as best we can. We did a big shift starting last Thursday with our meal distribution. We have taken them out of St. Clair Parks on Saturday and moved them back to Otterbein Methodist Church as a takeout and drive-through only due to the restrictions. And we're happy to be back in the church, but logistically, it takes a little bit of working out. We were happy that we were able to distribute 153 meals to people. We weren't sure that the news would get out or that schedules would let parents, you know, come to pick up the meal on a weeknight. We were a little worried about that, but it seems to not be limiting people. We are also very thankful to we have sponsors again for our meals weekly, and the restaurants are working to assist with making sure we get at least 150 meals each week. And then other restaurants, especially Jaffrey's, Sunset Cafe, Boulevard, Sundogs, have taken it on themselves to provide at least 10 to 20 meals in addition to what we have paid for, so that our folks get a hot meal, you know, that nobody goes without. That says a lot about our community, and we are very touched about that. We are also seeing a lot more calls for housing, and I know Ian's going to talk about housing, and I do want to just bring that up a little bit. Our homeless placement for September was 52 individuals, and already the first week of October, we've had 15 to 18 calls, and we've placed 16 people. And you know, we're just in the beginning of October, so we're a little concerned about that. As Jennifer alluded to, people now are losing their jobs, or the unemployment is running out. So the ripple effect is hitting hard that way in families. We've had a lot of calls for rent assistance as well, and continue to get probably 20 to 40 calls a week just for rent assistance. And then the case managers from Catholic Charities and Westmoreland Case Management, Housing Authority, we all work together and we all try as hard as we can to keep those folks in their homes so they don't become homeless. So we're working as best we can to do that, and we're really committed to doing as much as we can, especially in these challenging times for everybody. My one concern is about the emergency cold weather shelter. Alyssa, I know you're on the call. I don't know if Jesse is. I just have a little concern about how that's going to operate this year due to the COVID testing. They have been operating in prior years out of Welcome Home Shelter and Union Mission. But as we all know, anybody going into the shelters is required to have a COVID test first. But when it comes to the emergency cold weather shelter, you know, it's an emergency thing and it has to be immediate. So I think we need to really think about how we're going to handle that this year. Does that make sense to you guys?
Yes. Hi, Deb. It's Alyssa again. Yeah, it is on our radar. It's actually on our list of things to talk about. And just as you said, how we might be able to get access to rapid testing or other methods along those lines. But yeah, it's coming up to time when we're getting into the cold weather season. So we'll look to bring our group together to talk about it. Thanks for bringing it up.
Okay, sure. Thank you. I really appreciate you visiting that and look forward to talking with you about that.
Great.
For Feeding the Spirit and on our end, that's about all I have. Thank you for letting me speak today.
Oh, that's great. Thanks, Deb. Appreciate it. Let's talk a little bit more about that housing issue. Ann Emmerling, I believe, is here from the Blackburn Center. Ann?
Good morning, Phil. Thanks so much for having me on the call. I'm going to talk a little bit about what Blackburn Center does, and then I am going to speak a bit about housing issues. For anyone on the call who's not familiar with who we are, Blackburn Center is the agency in the county that provides a wide range of trauma-informed services to victims of domestic violence, sexual assault, or other crimes in the aftermath of those crimes. Annually, we provide service to more than 3,000 community members, and I can tell you that's just the tip of the iceberg for what we know is actually happening in our community. Lately, certainly with COVID, what has been difficult situations in homes for people has gotten certainly a lot worse when you think about stress in homes, where there's job losses, as we've been talking about on this call, telecommuting, which is a whole other kind of stress, kids schooling from home. There's a lot of extra tension and stress in homes, which can make what had been bad situations a whole lot worse. So we know that around the issue of domestic violence, there's a lot of things we need to be concerned about and have been concerned about. We have been continuing to provide all the services that we have available throughout the pandemic and are very busy on all parts of those services. Let me do a quick rundown of what that is that we can provide. We have a 24/7 hotline. That's 1-888-832-2272. Again, that's 888-832-2272. We do counseling and therapy. We go with people to medical and legal proceedings now that the courts are back open and we're allowed back in the emergency rooms. We're very busy in those areas. We have a civil legal service department for victims who have civil legal issues related to the victimization. And we also do continue to have our emergency shelter that's specifically for victims of domestic violence and their children. For all of these services, we've adapted everything we're doing to be safe for clients, for our staff, and for the community. We have PPE, and we give thanks to the county and the Community Foundation for those supports, and lots of guidelines for people about social distancing. And I'll tell you, we're getting some pushback with people, not with our staff, but with people in the community who are asking us to do things that are a little beyond what we'd be comfortable doing. So we're holding steady and holding firm on that and really being committed to doing everything we can for mitigation with the virus. So talking about housing. So one of the things that we do certainly is provide support to people with our emergency shelter when they have housing issues and safety issues in their home. There's lots of agencies. I know Dan Carney has been on this panel in the past to talk about the network of agencies in the county working on housing issues, housing insecurity, homelessness. There's a lot of good resources we've been working on, and Deb had commented on people in homes, kind of the housing first approach of saying, how can we avoid people being removed from their homes? What are the things that we can put in place for resources? We have been gathering resources around the community, things that are specific for victims of domestic violence, but I know with the broader network of agencies like Union Mission and Welcome Home and Community Action, there's a lot of people who are working on things to do to support people who are really faced with some significant housing issues with job losses and the financial insecurity that's going on right now. So I would suggest if people have questions about that, Dan Carney is a great resource to talk about the broader issues that are available. He's at Union Mission, but certainly if you would want to call us at our hotline, we can give more information about that as well. Let me wrap up by saying we're so appreciative of this opportunity, but also of the community support. You know, Westmoreland County has been a great place to be in the difficulty we've had with this pandemic, in the sense of the community just reaching out and wonderful support from the community. So we really appreciate that. Thanks so much, Phil.
Great. Thanks so much for being with us, Ann. Really appreciate that. We're going to round this out by moving on over to Jordan. Jordan Polito, who's here with us from the Hill Group. Jordan is leading the effort, the consultation group, the consultant that is leading the human services study that's being spearheaded by the United Way in partnership with the county and the Community Foundation of Westmoreland County. Jordan, over to you.
Good morning, Phil. Good morning, everyone. Thanks for having me as usual. And more importantly, thanks for the work of everyone on the call to make Westmoreland County a safe and decent place to be, particularly through all of this stuff that we're talking about. So very quickly this morning, I just want to give everyone an update on our assessment process. As you heard at our kickoff in August and at a quick update in September, we are in the middle of assessing the human services ecosystem in the county, meaning we are trying to understand in this time and in quote unquote normal times, what the system has in terms of its capacity to address the needs of residents of Westmoreland County. In order to do that, we are doing a lot of secondary data review. We've looked at a lot of reports from United Way and the Foundation and other places, and we are about to launch sort of our primary data collection piece, which is a survey, which we've alluded to on the last 2 calls. So likely on this coming Monday, many of you on the call or your colleagues will be getting a survey that will take about 20 minutes, which is a long time for a survey. But the reason we think it's important is because there are 5 sections on that survey that will be really helpful to, number 1, assessing human services in the county, and most importantly, number 2, strategizing about how to make it better for the future. So there are some questions on there about each organization. There will be some questions about demand, trying to map demand across Westmoreland County's geography. Where are you serving? Where is there unmet need? Where do we need to focus certain types of services in your opinions? We'll ask about the ecosystem overall. So what's collaboration and cooperation look like? Obviously, based on these phone calls, it's at a pretty high level right now. We'll also ask about your vision for the future of human services in the county. What do we need to be working on as a county or as an ecosystem of providers throughout the county? And then we have a few short questions on COVID-19 as well. So expect to see that survey. And also, just as a quick update, we do have a steering committee meeting. A few folks on the call here, Ann, who talked earlier, and others, Alyssa and Phil and Dirk, are convening for a virtual steering committee meeting just to check in on the data, to check in on what we're learning, and to give us some advice for the future. So that's happening a couple of weeks from now. Phil, that's all I have this morning. Again, thanks everyone, and check your emails sometime early next week for a survey that I'll ask you to complete over the month of October.
Great, thanks so much, Jordan. We know that I don't think we've had a study like this in a number of decades, and so I want to underscore how important it is. Alyssa, I know that the United Way is sort of spearheading this work. Is there anything that you wanted to add? Not to put you on the spot, but is there anything you want to add that Jordan might have, that you might want to emphasize or that Jordan didn't cover around the study?
Sure. Yes, the study is very comprehensive. The survey and the questions will take some time to go through, but this is really critical for us to see what's going on, to assess what has been the needs in the county, what we're looking for in the future. Very excited to have this kind of work done in cooperation with the county and the Community Foundation. It's really going to help us focus our resources in the years to come. So opening a study and seeing all these questions might be a little daunting, but you can save it, come back to it. There'll be 2 or 3 weeks of time that you can complete it. We ask that only one be done per agency so that we can make sure that we get the correct information across the board. So that's what I'd like to add in. We're hoping by December timeframe to have all of this work done and a report out. I know we're all anxious to hear what's going on, and we are providing data to Jordan and his group. So if anyone also has any information or data specific to their groups that they would want to share over and above the survey, I think Jordan would appreciate having that as well. So thank you for that.
Thanks, Alyssa. Yeah, and I would just add to that, when I think about why are we doing this? What's the point, right? Certainly, as you mentioned, Alyssa, it's really important information when we think about distribution of resources and where we're investing grant dollars or other community resources that are coming out, and that's really important. I would also say it's really important, though, for individual nonprofit organizations in terms of understanding, what their agency is doing and how they could expand or move, or who's not being served and how they might shift the services so they're not duplicating services. So I think it's important on the agency level as well. And I would also add that it's also important data for the commissioners to have and for the county to have. When they start thinking about how are they, what infrastructure do they have in place to support the human services sector, having a complete and clear picture of that would be really helpful. So I think it helps on all levels, which underscores the importance for everyone to participate in that process.
Right, exactly, Phil. And one of the pieces is going to be benchmarking Westmoreland County again to other counties of similar demographics. So we can learn from some other practices, see what other counties are doing in terms of funding, in terms of supply and demand. So it's really going to give us a lot of important information. So yes.
Great, thanks, Melissa. Well, I have one more thing. I want to sort of wrap up by thanking all of the leaders that are here with us. But I want to highlight one of our leaders that's been with us for a long time, Dirk Mattson. Dirk, I'm going to put you on the spot. As many of you may have heard, Dirk's retirement is right around the corner. And I just want to take a moment to personally and publicly thank Dirk for all of the time that he's put in and all of the heart that he has in this work. I know from my time at the Community Foundation, he has been somebody who has been so supportive and always thinking about the vulnerable populations in our community and thinking about what are the best ways in which we can advocate for those that may not always be heard in the county. And I admire Dirk's compassion and his focus and his leadership in our sector. And so I wanted to say thank you. I know, Alyssa, you also wanted to say something, so I'm going to pass the ball back over to you as well.
Thanks. Yeah, to echo your remarks, Dirk and I have had many great conversations, shared a lot of information back and forth, what's happening in the county with in various departments, what the United Way thinks is going on that's important, 211 data, all kinds of things. And Dirk just has a great way of thinking through issues and problems and how to get things done despite of some obstacles that that are out there. And I do appreciate having the relationship we've had, the support that he's given to the United Way and to all of our partner agencies and others in the community. I know he's going to retire, but he's not going to leave us totally. He'll be around and about. I know still giving some of his expertise and thoughtfulness to what's going on here. So thanks, Dirk, very much.
Well, thanks for the kind words, Alyssa and Phil. I value your opinions, as you guys know, highly. It's been great working with you as well as all the other leaders that are on the phone call. My last day is going to be October 30th. I just feel so blessed to be able to have the kind of experiences I've had in Westmoreland County in the positions I've held throughout the 8.5 years or whatever the time frame is that I've been in county government. It's been a great learning experience, and I feel like I've just had such a opportunity with all the different departments I've worked with to learn from the people around me. So thank you very much for the rich experience I've received in Westmoreland County, and hopefully you'll be seeing me around in some other capacity. I think for the first year, I'm just going to take the year off and do some things that I'm really passionate about. Hiking the Appalachian Trail is one that I have on my agenda for March. So I probably will be semi off the grid for maybe 5 to 6 months. Next spring and next summer. So, after that, we'll see where I am and go from there, but human services will always be near and dear to my heart. So thank you all for all the partnerships over the years and the kind words.
Thanks so much, Dirk. You can't hide your leadership from us that much. So we'll find you. We'll find you. If I could, I'd give you a big hug right now, but we'll save it for another time. There we go. Well, thank you everyone for joining us again for this monthly call. If you have any questions or concerns or need anything, feel free. I know Alyssa is always available as I am, so feel free to reach out. Thanks for your hard work and your dedication, and we'll reconvene in a month's time to get another update. Thanks so much.
Thank you, everyone.
Bye-bye.